Hi, I'm Dr. Benjamin Twill. I'm a general otolaryngologist at Mount Sinai Hospital. Thanks for joining us for a discussion of general ear, nose, and throat issues and how to address them during the stay-at-home crisis during the coronavirus. So I treat all sorts of conditions of the ear, nose, and throat. Many of them are things that are acute, but a lot of them are also chronic or recurrent problems. Diagnosis of these problems and treatment of them depends obviously on the individual condition itself and will depend on an assessment, either in a discussion with me, a history, or a physical examination, depending on the condition. Treatment, of course, depends on what we come up with and what the plan of management is that you and I will decide going forward. So patients will come to me either as referrals from their primary care doctor or from other specialists, such as allergists or lung doctors, or they may come as self-referrals, patients who have decided that they have a problem that they need to see an ear, nose, and throat doctor for. A number of those people will have friends who have had similar conditions who will say, you know what, I got a lot of help seeing an ear, nose, and throat doctor before, maybe it's something for you. Many patients will call our office directly and say, hey, I have this condition, I'm not really sure what to do about it. Can you help me? And they will help set the patient up for a visit with myself or a colleague. So there are a number of different common conditions that I treat. Thinking of the ear to begin with, so a number of common conditions include tinnitus or ringing in the ears, a couple different forms that can come up that can come across in hearing loss, dizziness and balance problems. Thinking of nasal issues, chronic stuffy nose, recurrent sinus infections, itching, sneezing, allergy type symptoms, problems with the sense of smell, problems with the sense of taste as well. Throat problems are a common reason why people come to see me also. Trouble swallowing, voice changes, sore throats, recurrent tonsil infections. There's a number of causes of different conditions that come up in each of those areas. Not to mention other issues as well, lumps and bumps that people may have noticed, infections of the ears or the nose, especially if they're recurrent, problems with the saliva glands, or other issues generally in this area of the body. There are a number of common ear problems that we see over and over again. Tinnitus, for instance, or ringing in the ears, it falls into a couple different subtypes. The most important thing in figuring out how to treat it is figuring out which subtype it is, and that involves a conversation, oftentimes a hearing test as well. Treatment of that is going to depend on what subtype it is, and it may be something as simple as removing some earwax, or maybe a little bit more complex depending on what the other underlying cause is. Most types of tinnitus respond really well to a treatment called masking, which is having some sort of background noise going that can disrupt the pathways that cause the tinnitus to continue. Hearing loss is another common concern. Hearing loss, of course, can be treated with hearing aids, but there's a number of different causes of hearing loss, so it's not always quite so simple. And there may be some treatments that may allow this to be taken care of in a more definitive way that doesn't require things like hearing aids. Ear infections, it depends on the type, and it depends on the frequency, depends on the other conditions that may be playing into that. Treatment may be something like ear drops. Treatment may be antibiotic pills. Treatment may, in some cases, even be drainage or cleaning of the ears. These are often treatments that are available in the office, and over the phone, we can help determine if that's something that's necessary for treatment. Nasal problems are common as well, as many people suffer allergies, many people suffer nasal obstruction, many people suffer recurrent sinus infection. So we see these problems all the time, and we have very good methods of treating them, even in patients who haven't responded well in the past. Something as simple as a nasal steroid spray may be all it takes. Sometimes it's a little bit more involved. Sinus rinse or nasal saline flushes are very helpful in a lot of patients and can avoid some of the side effects of medications. And the treatments go all the way up to and including surgery for the right candidate. I frequently see patients who have swallowing problems. Swallowing problems can be a feeling of a lump in the throat. It can be a feeling of kind of dry mucus stuck in the throat, or a feeling that things just aren't going down right. Or it could be something a little bit more significant, including coughing or choking or having difficulty breathing when swallowing. All of these can be helped. And again, the treatments vary widely depending on what the problem is and how we address that problem. Could be as simple as drinking more water or watching your diet. It could involve a little bit more intensive of a workup to determine whether or not there's any problems with the underlying mechanisms. And oftentimes those problems end up being treated with some special form of swallowing therapy. Patients who have chronic cough come through the office very frequently. It's a very common problem. There's a number of different causes, as you may imagine. Some of those problems have to do with the voice box, some may have to do with the sinus, some may have to do with allergies, some may have to do with acid reflux, and we treat each of those differently. But they may have some conditions and some treatments in common, including things like making sure you're drinking enough water, allergy treatments, hydration or lozenges. We also want to make sure that we're evaluating how other medical conditions such as asthma or acid reflux play and treat all of these accordingly. Well, if we've determined that a patient would be best served by coming into the office for an appointment in person, there are ways that we're making that safe for all involved. We obviously want to minimize the risk of our patients having exposure to coronavirus. So we have a rigid program of screening before patients come into the office. That involves telephone interviews with everybody coming into the office. That involves screening when patients are coming into the office as well before they even enter the office. Beyond that, we're practicing social distancing in the office. We're reducing waiting room time and trying to minimize any time in the waiting room as well. And we've actually reduced the patient volume as well to make sure that we're not having overlapping patients coming and going at the same time. On top of that, we're practicing rigorous hand hygiene for ourselves, as we always do, but also encouraging the same for our patients, which is normal protocol in our office, but we're taking special precautions right now. In addition, everybody is wearing masks. That goes for both providers and the patients. And this is both to help you and to protect those around to minimize the risk of any other transfer that may happen. Well, for patients who have had problems that have been going on for a long time, I think a lot of people end up staying at home saying, you know what, I'll deal with this once the crisis is over. But a lot of these conditions are chronic, and there's no reason that we need to wait to get treatment started. Now, if we need to have the patient come into the office, we can figure that out. If it's something that can be addressed at home, then oftentimes we can get treatment started and then figure everything else out a little bit later, depending in part on response to treatment. So again, it's not a reason to not treat yourself. If you're suffering from something, we can move the ball forward and get started on that. So currently, at the moment and over the past several weeks, office visits have been reserved for patients who have more emergency type complaints. These have been things like abscesses or infections that require drainage or active management. Going forward, very shortly, we'll be able to bring in patients who have perhaps less emergency, but still some urgency to their complaints. These may be conditions where by delaying treatment substantially, we might be putting the patient back a little bit in the way they're able to be treated. Something like nasal polyps, for instance, or chronic hoarseness or evolving hoarseness, where we'd want to make sure that we're evaluating for infections. And also, of course, if we have any concerns for things that might be cancer, or if cancer is on the patient's mind, these are reasons that we'll be able to bring patients into the office to address these problems in person. I like to think of every patient as a whole person and take into account not only the reason that they're coming into my office, but how is this impacting them, and how do their other medical conditions and maybe even some of their other social considerations or job considerations play into this. So my primary concern in many or most cases is making sure we're avoiding anything that's, making sure that we're treating anything that may have the potential to cause medical harm if it's not addressed. Things like tumors or nasal polyps that might grow substantially and end up leading to further complications from that, untreated ear infections, things that may require treatment to prevent further complications down the road from happening. Obviously, that's a big priority for me. The other equal, but maybe secondary priority would be making sure that the quality of life issues are addressed. And these can be significant. Patients who have chronic hoarseness, for instance, may be worried that they have a cancer, but even if we've determined that they don't have cancer, this may be impacting their day-to-day in a significant manner. So taking that into account is important. And that involves treating the patient holistically as a whole person. And again, taking into account their other medical conditions and how these problems may be impacting their quality of life as well.